So today we have an invited seminar of Dr. Isabel Gomez, Maria Isabel Gomez, from Universidade Nova, Lisboa. So Isabel has been here with us for the week in an Erasmus exchange. So she has been here working with us in several problems. She's working in operations research too in Portugal. And we have a common friend, which is Patrick Hirsch from Austria. And then he kind of introduced us using, email, online tools. And then I visited Lisbon last October or November, I don't remember. And then I meet Isabel there, and I invited her to come over and visit us here for a short stay. And then we have been this week discussing some potential collaborations in different problems, multi-depot BRPs, or other facility location problems, and so on and so forth. And I asked her to give a seminar to explain us about the research topics she is in. So thank you, Isabel, for accepting our invitation.
Yeah, thank you for inviting me. So good morning. So this was the title proposed by Angel, Operations Research in Portugal. Well, it's my personal journey, okay? It's not Portuguese operations research, which is quite a big group of people working on operations research. And in fact, I started on supply chain with my PhD thesis. And then recently, I went to healthcare services and problems. So I will just show you a little bit of my journey in operations research. But before, just let me show you some information about myself. So I'm assistant professor at the Department of Mathematics at the Faculty of Science and Technology of Nova University of Lisbon. So the faculty we usually say, is on the other side of River Tagus. So it's in a campus in Caparica, away from the Lisbon center. It's a very nice campus with trees and buildings. You've been there, Elena? Yeah. It's a very nice campus. So close to the beach. Yeah, close to the beach, 5 minutes car to the beach. But I never go there. So this is the whole campus. It's quite large, and this is the 7th building, and my office is over there somewhere. So I teach engineers. So I teach first year mathematics for engineers, and also some classes of the master in mathematics applied to operations research, statistics, and actuarial sciences. I'm also a researcher at our center, which is the Center of Mathematics and Applications. So that's me academically. So what will I be speaking about this morning? So first I will speak you about supply chain design, which is my main research topic. And in particular, I will speak to two current works, one about sustainability and the other one regarding uncertainty and risk modeling. And then very recently, I started to look into problems, healthcare problems. And this is really a short number of slides. I will just explain you the problem of home healthcare, and then a project that we submitted in January about hospital capacity planning. So what's the motivation behind the supply chain problem that I've been working? So legislation, the price of raw materials, and consumer awareness has led companies to change the management perspective regarding the return of products. So until now, the major concern was about to bring products from factories to customers. So all the process, all the supply chain from the production to the final consumer. But now companies need to also think about the products after use and after being disposed, what to do with them. And so regarding the management, they have to take into account the product recovery activities, and this has turned out that the reverse chain management is now, in some industries, a common practice. Well, there's a lot of industry to start thinking about their reverse logistics, but it's starting now. So when a manufacturer, when a company both manufactures and remanufactures products, and this is performed by a single player, then is responsible for the forward logistics and also the reverse logistics. And they should be designed simultaneously in order to take the synergy between both flows at the best possible way. And when doing this simultaneously, we are in the presence of what we call the closed loop supply chain. So it's not anymore the forward chain, but both forward and reverse. And so the problem I study, and I still working, is so you have the factories that have a raw material supply that produce brand new products, send them to warehouse or distribution centers that send them to markets. And after use, the markets dispose the products. These are collected and sorted at sorting centers. And then, depending on the quality, they might be disposed if they are contaminated, or they can be remanufactured by the factory. This factory might be the same one or another one. It depends on the product and on the type of recovery activities. So the problem I've been working on is, we can say it's the capacitated facility location problem, because the idea is where to locate these entities in order to supply and recover products from the markets, but in the context of multi-site, multi-product, and multi-period. And the multi-product cannot be worked separately, because products are mixed into the next level. So you might have raw material 1 and raw material 2 that produce in different composition product 1 and product 2. So you cannot split the network into product networks, one for each. Okay? So the one of my works, the last one of the PhD, in fact, I modeled this product as an optimization mixed integer linear programming model. And every node, every entity, either whatever the type of entity, or if it was really the market. So it's a node, so you have a graph underneath the structure. And each node, you have inflows, input flows, which are the arcs bringing the product. And then you have the output flows, which are the arcs sending the product. And between these two flows, within the node, there's an operation. And so products are transformed, input products are transformed into output products. And this operation allows the modeling of production or storage or product usage or sorting activities. So this operation within each node, transforming one product to another, models in a macro way these kind of activities. And each operation is characterized by a time, so we can take some time to make these activities, and also a capacity. Okay? So the arcs, so the connection between nodes, every arc has to have an origin and destination, of course, to link 2 points. And each arc has a material, so if you have between a factory and a warehouse 3 products flowing, you have 3 different arcs. These flows may take time, so it depends on the time scale you have chosen. You can take some time units to go from origin to destination. And also, they are capacitated. You cannot send as much as you want. You have a limit on this capacity. So I will not show you the model. It's a MILP model. I just want to show you just some results, some details of the model. So we applied it to a case based on the Portuguese glass industry. So we have 18 customers, which are the major cities of Portugal. And as possible locations, we allowed 4 for the factories and 8 for warehouses and the collection centers. Regarding time, just looking at time, we modeled it a little different from what's used in the literature. Although it's a discrete time scale, so you have a time horizon divided into discrete events. In fact, we classify the events in 2 different ways. So you have the macro events where you have, for instance, the demand to be met. And then you have the micro events, which allows you to model the time that flows take from going to the origin to the destination, or time to produce products or to use products. And these scales can be whatever fits best the model. So it can be years and months, or months and days, days and hours. It depends on what's the scale that best fits the model. And so for this problem, we have a 5-year time horizon divided in years, and then each year is divided in 2-month periods. So in a Portuguese context, 2 months is too much for traveling. So the traveling times are 0, because there's 2 months to go from one place to another. You have to be walking, and even though walking, maybe you don't need that much. So all the traveling, all the flows have time 0. They are assumed as instantaneous. So this is just to show you the forward and the reverse network. The reds are the factories, which have the same locations. And given Portuguese structure and the way the population is divided, you see that everything here is in near the ocean. Because if Portugal was a ship, it will sink, because everyone lives here, near the ocean, and no one lives there in the inland. And so, since the demand and the returns were depending on the population of the cities, the locations have to be there, and there are some shared flows because of capacities. They have to share. They have to be supplied or recovered by multi-sites because of the capacities. So this small problem, this problem is, I think there's one O. Okay, cannot be 11,000. Yeah, it's 11,000 binary variables, and you have 51,000 total variables. And we were able to solve it optimally in less than an hour. So this is one case, and just to give you just some idea of the information you have. These are the supply of raw materials to one of the factories. You have 2 components to materials, and this is the supply over the 5 years and within each year, each period of 2 months. And here you have the warehouse supplying plan, so how much it receives from each of the 3 finished products in each of the months, so that it supplies the customer. So this work has received an award from the Euro Association. It was awarded the best de jure paper in 2010 and 11 on theory and methodology, and so that's me, proud of receiving my award in Rome last year, well, 2 years ago. So that's the work that I've done in my PhD, and now this work evolved in 2 directions. So one of them, it's sustainability. The model was developed for cost minimization, but in fact, companies are not worried only about cost. They are worried also about the green image they gave to the customers. And so they also want to minimize the environmental impact so that they can have a greener image to attract more clients. So the minimization of environmental impacts is another objective that you have to take into account. But sustainability is not only the earth, nor the economics, but it's also about the people. So it's there are three drivers in the sustainability. And one thing that companies are being pushed to look into is the social impact. So the human conditions, workers' human conditions, and the population surrounding the companies and the factories, and the maximization of the social impact or the social benefit is emerging. And the European Union is preparing some legislation that will push companies to address these issues. So Bruna, my PhD student, is trying to think about, or she's thinking about, how do you model social benefit? It's not as easy as you might think at the beginning. Another direction concerns uncertainty and risk modeling. So the models are, the previous model as developed as any traditional model for average values. We know that we don't live in an average world. And so we decided to include uncertainty in several different points of the model. So we have demand and return volume, which is in a MILP model. In an optimization model of this kind is the independent term of the constraints. Transportation costs, which are terms of the objective function, and also on the returns quality. When products get to the sorting centers, companies or sorting centers don't know the quality they have. Because when you're producing, you control the quality. You have some quality management and you take some samples and you see and you evaluate. But when you collect, you never know what's coming. So quality is a big issue in return flows, something different from the forward flow. Because at the beginning, when you look to both problems, it seems that they are the same. It's just to reverse the flows. But they are not really the same. The reverse flow, it's more complicated. Maybe because it's not being studied enough, but it's more complicated than the forward flow. And one thing that concerns return quantity, which is there, and quality. How are the products arriving at my site? Because depending on the quality, I can resold products with minor changes. They can be proper to be remanufactured, sorry about the typo, okay? Because they can be dismantled and sent to be remanufactured or recycled, okay? Some reward. And then they can be contaminated. And if they are contaminated, they cannot be used and they have to be disposed. And again, there's also a problem here. How do you dispose these products? Where do you send them? Which is the proper disposal activity you should do. So these are the source of uncertainty. This return uncertainty, in fact, is in the A term of the constraints. So it's the coefficients that multiply the variables within the constraints. So we were really crazy and decided to put uncertainty everywhere. You'll see the problems that came up. So traditionally, we have risk-neutral models. So you define scenarios. It's one way. And you define scenarios, and then you try to design the network that is the best one for the average objective function value, such as costs or profit or something like that. But we also want to take into account the decision maker perspective toward risk. And risk neutral doesn't take that into account, and we decided to go into some risk averse measures. Okay? I will detail a little bit more afterwards. So sustainability, as I told you, concerns these three objectives. This one is being studied a lot. It can be either minimizing cost or maximizing profit. It's not really the same, but it's been a lot of study there. This one is quite being studied also, not as much as economic function, but it's been already studied. Not the social impact. And in fact, we don't still know what are the best measures to define social benefit. Because If you think as locating in countries with lower GDP to improve their quality, their economy, or if you think that you should model such as locations with lower or with higher employment rates so that you have people working, or so you want to maximize employment overall and not employment rates. So if you think about that, in fact, you're pushing the model in the opposite direction as when you do it for cost of profit. Because what the model will do, the model is a mathematical entity, so when you're solving it, you're solving matrices of value, so it's algebra. It doesn't know that X stands for people or X stands for product. And so the best solution is to open everything everywhere. And that's not really what companies should do, because they cannot save the world and open one site in every possible location. So in this type of context, how do you model social impact? Has been the issue that Bruna, poor girl, is doing now. So this is one of the questions that we have not answered yet. It's what are the best functions, okay? So another one is we have a multi-objective problem. There are some standard procedures to solve multi-objective problems to find efficient solutions over the Pareto front. So like epsilon constraint, where you set some bounds and get the different efficient solutions, and then you allow the decision maker to make some contribution. But is there another way to deal with this three-objective problem? Can you take advantage of parallel computing to solve this kind of multi-objective problems? So that's open. We haven't done anything in here, but I think there's some space to go and to study, because it takes a lot of time to to get each point in the Pareto front. So each efficient solution, it takes, in terms of computational time, it takes days to do it. So maybe not each point a day, but it takes days to have a reasonable Pareto front. It's approximation. We don't do it to optimality, but it takes time. This work has been published in two papers. This one is from a conference, and this one is available online in the Journal of Cleaner Production. So concerning risk and uncertainty, as I told you, we addressed uncertainty in several parts of the model, and we designed both risk-neutral and risk-averse models. Okay? This work is a work that has been developed with Susana Batista, which is a colleague of mine at the department, and recently I have the collaboration of Laureano Escudero. He's working with us in this problem. So how do we model the risk-averse? So we decided that, well, each decision maker has its own attitude towards risk. So since we have a multi-period framework, we allow the decision maker to set some profit thresholds. He says, I don't want to have a profit under this value at this time and that time. So in the future, he says, I want profit to be at least some value. And then he says, for those scenarios, these are modeled as soft constraints, so we allow deviations. And we don't want the scenarios to have the bad scenarios, the ones that are not as profitable as the decision maker may want. We try to control the probability of occurrence of those scenarios. Okay? This over the years. And so the decisions are taken, so where to locate and the amounts that will be circulating in the network are taken so that these deviations from the profit and from the probability are minimized. Not really all the deviations, because the ones that go above the threshold, we allow them, they are the good ones. We are just penalizing the ones that go below the threshold. We allow them to exist, so there are some scenarios that are under profit, but we try to minimize them, or at least minimize the impact they have on the network. And so, what are the open questions? So here the problem is not the model is developed. We have a nice formulation. The problem is that Cplex, which is the way I've been working until now, so the work I've been doing is mostly on the modeling side, and we say if you have good solvers, why not invest in modeling different issues and try to Cplex or other solver to work as a black box. So companies, in fact, they want the problems model, and the way they are solved is a question for researchers. And so we decided that we want to address issues that companies have and not focus so much on how the way they are solved. We put them into a solver and analyze the results. So the problem is that the best solver now cannot solve medium-sized problems. And they cannot solve it because the risk neutral is not that bad. It has a nice structure. You have some complicated constraints, but then if you duplicate them, you have a more or less block structure in the matrix, so it's more or less easy to solve. The problem is that the risk-averse model mixture all the scenarios, since we are computing the probability of having some scenarios, you have to take all into account in the same constraints. And so that nice block structure used for the composition techniques just fall apart. And that's really our problem, is how can we solve medium-sized problems? Since our models don't have the structure that the traditional composition methods use. Okay, so that's where we are now, is not really to model it, it's done, is how you solve an interesting problem. Now the problems are toy problems. One factory, 3 customers. That's not really what you should be doing, and that's really the question now is how do you address this reverse function, which I think it's very interesting because it takes into account the different, it may allow different type of decision makers. It's not a common one since it's the one establishing the thresholds. The problem is that, so you pay it afterwards by not having a nice mathematical structure behind it. So this is risk and uncertainty. And so I finish supply chain. If you have questions, just interrupt me and ask me anything, okay?
Are these programs linear?
Yeah, they're mixed integer, linear, okay? So if we have problem with mixed integer linear programming, how would be if you had a non-linear formulation? So we don't even thought about it because, well, the probability in nature is non-linear, but the way it was modeled, we've done it linearly. So it's binary variables and stuff like that. And so this is really a question for linear models. I don't know, non-linear models must be, forget them. I don't know, I will never try it. Maybe it's an interesting thing to see it. It's how do you do it both. But these are multi-site, multi-product, multi-periods. These are really, it's as close as you can get to reality. This is not the traditional facility location model or even the warehouse location model, which has a second level. It's really not operation research classic models, settings, okay? So that's why we don't have benchmarks. There's no benchmarks for these kind of problems. There's no algorithms, neither exact algorithms or whatever algorithms for this kind of problems. So this is supply chain. And now I'm almost finishing, so don't worry, it's really short presentation. What about healthcare problems? Well, behind healthcare, my major concern when I started to think and looking for collaborations concerning healthcare problems is, in fact, the aging society that we live in. So at least in Portugal, we are one of the worst birth rates. We have one of the worst birth rates in Europe. So our demographic pyramid is getting like this. And so I'm in the middle. When I'm old, no one will take care of me because there's no people to take care of older people. This is a rather self-centered perspective, but in fact, we have already those problems. People are alone, older people are alone, and many of them are at home, are locked at home because they cannot go out alone. So the aging problems are really, well, they are still not that economically strong, so people have not yet starting to think about them, but they will be in the near future, not in a medium term, but in the near future. And there have been those initiatives, and the European community has been financing some project of something for older people, like gadgets to put on the pocket so that if they fall, people understand, or some telecommunication. But you were at the meeting in Wednesday. There were some, I think, psychologists studying how did older people react regarding some devices, and they were not really pleased about it. Why do I have to use this? If I fell, I have my mobile phone already. So they are not that really, they are not really open to new things, which is a characteristic of being older. We will be there, all of us. So my question is, those gadgets really what people need, or what people from our generation think they will like to have when they are older? Not really what, maybe when we get there we don't like those things either. I don't know. And so one of the conclusions of that study was that you should, well, at least that's my interpretation, you should help people in a way that you will not disturb the way they are living. Because older people don't like to be, they have their routines, and they don't like those differences. So just leave them as much as possible with their routines and help them live their way. So my question has not been in those tele gadgets to help people, but rather on how do you help people being independent in the way they live by supporting them? And that's really being my concern. And so we went to speak with a social assistant from one community near Lisbon. And well, she has a home health care service. So she has some nurses that go to people's home needing support. Some of them just need some cleaning activities, not much of that, but others need 3 times visit because they wear diapers and need someone to change their diapers. So it's really difficult. There are different activities, and each patient has some difference regarding the other. So the problem, she just told us, I want to have something that helped me to say that this nurse goes to this patient, and after she goes and visit this one, and after she goes and visit this one, so that so that they meet I can meet the time windows that patients want to be visited, if it's the first thing in the morning, or if it's near lunch because you have to help them having lunch, or if it's in the afternoon. So each patient within a week should be visited by the same nurse. They don't want to change nurses within a week. They want to change week from week, but not within a week. And then these nurses work from 8 to 4, and so we don't have those large working periods. And this problem, this is a rather small problem. We model it as a weak vehicle routing problem with time windows. So in fact, it's an extension of the traditional vehicle routing problem, but now we have 5 days, a week of 5 days. And we have to ensure total loyalty between the providers and the people having the service, okay? And this constraint doesn't allow us to look in this problem as a day problem that you can expand over the week. It has to be the week altogether, okay? And so if VRPs alone are NP-hard problems, weak VRPs with time windows and other small stuff that I didn't give you all the details are NP-harder, okay? So this is one of the questions. How are we going to solve it? Always the same issue. But then there's another thing, is that these tools are to be used by people that don't have a background as ours. So they don't want to know anything about the way it's solved. They just want to put data in an Excel sheet, and in the next Excel sheet they will have the solution. That's it. Nothing else than that. Because they don't know how it works. They don't have to know. They know other things. They are social assistants, human resource planners, whatever. They don't have to know the technical. So, and some of them, at least in Portugal, some of these services are provided by social groups like parishes or associations or fireman corporations that are not there for the money they can get out of it, but rather because people need support and they try to help. So they have no money to spend on super class solvers. It has to be freeware linked with, well, I put Excel. It doesn't have to be Excel. It's just that almost everyone knows how to work, at least putting data and reading Excel. It's just that. But it has to be an input-output tool easy to manage. And so this is not avant-garde research, but I think this is neither consulting, because this doesn't make money out of this. So this is, I think, a way of knowledge transference to the society, and we have to help in this transfer of knowledge. We should not, this is our social impact. And we as researchers, I believe we have to have some kind of social impact. It doesn't matter if you study the whole life in a desk. You have to be able to translate to the community. And so this is something, is like my long-term dream, is to have a tool that I can provide it for free that works fine. It will not work top best, I'm sure, but it will work fine. At least to some point, helping people to have a first solution that then they can adjust, and that would be fantastic to have some tool that they could shift the nurse and then recalculate it afterwards, okay? So I'm just dreaming, okay? Not really. Now it's a VRP with time windows that doesn't solve. That's the current. And other thing is that these are really dynamic in nature. So companies, when dealing with customers, they are the loyalty behind it. So they try to have customers stay with them as long as possible, so they don't change their customers. There are some new ones coming in, but the number of those that are coming out in a good environment or in the enterprise environment is not, at least at this context, is not that much. But here we are dealing with people needing care at an old age. So you might have some people with disability that need a long-term care, but older people may not have a long-term care. So there's plenty of people going out the service because they are too dependent to be alone at home and need to go to a nursing home, or because they died. And there are lots of people coming in. So this is, every week there's people coming in and people going out. So one thing that I think it's important is, how do you replan an existing solution so that you can accommodate these new ones and those that left, but you're dealing with people. So you have to be careful when you're changing people's lives. So it's not let vehicles and it's not products, it's real lives. So how can we do this? And this is, I've not tackled yet, it's just some concern I have. How do we redesign routines or redesign nurses' work plans? In a way, they integrate new patients, they do not visit some that left, but they do not impact too much on those that are being in the system, that stays within the solution, okay?
In reality, Isabel, can I say something?
Yeah, of course.
In reality, with the Portuguese PhD student of mine we deal with, which is very different, but it's similar in retailing. What is retailing now? The retailing driver that delivers products in the store, and now it also does some marketing activity. So in the past, it will go lift the box and left. And now some of them also try to convince you to buy new things. Think about people that deliver at home, you know, the frozen food. So they have some sales activity. So one of the things the company told us that, like, for example, what they do is that maintain always the same driver to the same customer.
Yeah, so the total loyalty.
To create a relationship, if there is a relationship, you can sell more. But that is very expensive because, as you said, especially think about online customers like frozen foods. You know, every week there's different, every day there is different
thing.
people.
Yeah.
So, in this company they have this. Each driver has a neighborhood. Then there was fights about the drivers because, you know, they get paid in function of what they sell, and of course, if you have a good customer, you make more money. So you fight with the other driver that, you know, as
you have a better.
You assign me bad customers, so I don't make as much money because you assign me my bad customers. So then they will try to optimize the distribution cost. What happens with distribution cost? It's just vehicle route. Simple vehicle route. So every day the customer is a different driver.
Yeah.
So we try to establish a balance between these two objectives. Have the same driver always to the same customer and minimizing the transportation cost. So in a way it's similar. Or I believe that the nurse, you know, try to maintain the nurse to the same
house
along the time, because she will know, he or she will know the house, will know everything.
In fact, it's not really like that. In fact, but it can be more or less as you're saying, because they are teams of two, and they are how you say it in English. People get used to be with the other, and then they abuse, but not in the extreme sense. So, for instance, she told us that one of the ladies that took care once was offered a piece of cake, and every time she went visiting this lady, she had a piece of cake, even if not offered, because once she was offered. And so the cake that the daughter baked every weekend for her mother would disappear over the week because the cleaning, the assistant would have the cake. So this intimacy that is created with a really long term makes those problems. But in fact, what we decided was, well, you don't have to think of the person that is going to visit. You might think that there's a team going there, and the team must be the same, okay? But then the team composition changes, and she wants some rule, like one people stays 2 weeks, the other change, and so that there's no, the transition is not that hard. But in fact, it is total loyalty for the team, but then each team, it's mixed. That's this case.
Yeah, we have similar cases.
Yeah, but it's similar.
They told us stories that a driver and the one person on the store have a different soccer team.
Yeah, so it's terrible.
One from Barcelona, not from Madrid. So when there is these games, they will spend 2 hours discussion, and everyone was late.
Yeah. It's more or less the same.
It's really, for us, like mathematicians, but how can I model this? I mean, it's like,
Yeah.
but that's the
That's
reality
reality.
that they are facing, and it's quite interesting what you say. It's a good idea of the film. Yeah, I like it.
As you know, we have already a very similar paper for this problem.
Mhm.
It's
Oh,
review in
yeah.
the journal, which is related to the similar problem in the city of Vienna.
Mhm.
So people had to be, visited
Mhm.
over at home. And then I think the problem we solved, Enoch solved, was related. It was a little bit more difficult than this because we also were considering like car sharing.
Mm-hmm.
So we wanted to, the nurses or the doctors to share cars, to share vehicles, so not each of them go to the patient with his own vehicle or her own vehicle. And then we wanted also to include the possibility that like multimodal transportation, so they can also walk or take a bike or whatever. So I think the approach we developed for this paper is really very flexible, and I think it could be easily adapted to solve this.
So we have to talk.
So maybe we can try if you are able to provide us with a very clear description of the details, so we make sure we are not working on the wrong problem. Then I think I can ask Enoch. I guess he will agree. Do you agree, Enoch? Yes.
Yes.
So,
by not being present. Yeah. Now this is a small case. Is a nurse's walk, but of course you don't solve a case. You use the case to be inspired to know the problem, because you're not solving each case alone. Because we have another case similar with this, but a larger area. So the nurses cannot walk. This is all walking distances, but in another neighborhood nearby, it's not really walking distance. Well, some of them might be walking distances, but others are not. So they either have their own cars. I don't know how they work, but either they have their own cars. They have one car that delivers nurses at some patients, and then maybe it's really reasonable to do it walking. So I think the second case will have data very similar to that
the
one.
real complexity in our case was the car sharing.
Yeah.
Without the car sharing, I think the problem is
much easier.
Easy to be solved. Car sharing introduces a lot of complexity because you have like 2 VRPs that you need to synchronize, and they work differently. You need to synchronize the movement of the cars with the movement of the nurses.
Yeah.
It's really difficult, but without the car sharing, I think the problem can be solved.
Okay, so you have to continue talking. And the last one is hospital planning. So this was an invitation I received from a colleague from our Tropical Medicine Institute in Lisbon. And we submitted a project in our last call for scientific project, which ended last week. It was a crazy month, January, to prepare the project. And so there's a new hospital to be built in Lisbon. Well, it should be already almost finished, but they didn't start it yet. So there's a new hospital that will, at the beginning, the objective, the political idea was to merge all the different hospitals that exist in Lisbon, which are almost 100 years old, so they are quite old buildings. They wanted to put everything together in a single hospital. But this has been changing, and since they are getting late as time goes by, I think when the hospital is in fact there, things will not be as predicted. So this colleague of mine challenging me to think about how do we plan the capacity of the hospital so in the next 30 years it will be able to accommodate the needs. Okay? So there are some prospective tools behind it to project the needs into the future. But you have to have some ideas of how do you define the capacity even for today. So traditional hospitals were planned in terms of number of beds. But in that case, you assume that the person spends at least one day and a night. So a bed, an occupied bed, corresponds to a patient. But in fact, with ambulatory services, you need one bed for some hours of the day, and the night it will be available. Hospitals also have outpatient services, so you make an appointment, you go there, and you leave. But the doctor that you see in the outpatient service might be the same doctor that has in the surgery. So we'll have some patients in infirmaries as a traditional hospital. So there's many shared resources, and you have to plan this in some way connected. So apart from how do you project to 2050, but this part I really trust my colleague, as is I just want to have the projections. I have to think about how you plan the capacity. That's my task. And another thing is that, in fact, beds have been shown to be not good measurements for capacity planning. And now there's a new philosophy, which is patient flow. So people have to go through a number of different activities in the hospital, and these activities might be shared by different services like X-rays or blood tests or those kinds of services. So instead of linking patients to beds, you should instead model patient flows and then to design the hospital in terms of patient flows and not in terms of persons, but rather on all the service it will be provided since it enters until it leaves. Okay? So what are the open issues? Almost everything. In fact, one thing I know is that the framework is more or less a goal programming framework, because the idea is to design a tool that will allow the decision maker to try different scenarios. So you might have an idea that he wants to meet this target at this time, or that target at that time might be the number of ambulatory service or the number of surgeries, and these are goals that you want to achieve, but these goals are constrained by the capacity and the structure. And so what I see is a goal programming approach, but okay, that's it. So here, I think we have plenty of, in Portugal, no one does this, no capacity planning. hospital capacity planning, surgery capacity planning, emergency capacity planning, okay. But integrated capacity planning, I don't know of any.
Send me a mail because, I mean, it's not much optimization. But last year I was in a PhD thesis of a doctor. She's the vice director of a hospital here, Belvice, which is a huge hospital. And she did a thesis on operations management of a hospital.
Okay.
And maybe, I mean, I read it, I don't remember much, but it's like a previous part of the operation research application because she analyzed a little bit how the operations should be organized.
Okay.
What are the issues? It's more from a management point of view, not so much from the optimization point of view.
But it's the first step.
It's the first step. And she's very, very nice person, nice girl, and well, young person. And I like it very much. And she defended the thesis last year, and she's the vice director of the operation of the hospital. So she's a doctor.
She knows. She's there.
Because I found it difficult to talk with doctors. I think we have like a different
I know.
language. We talk about optimization, they get a little bit nervous.
Yeah, and scared. Yeah, I know. Because I've been in contact with some doctors, and it's even with my colleague from the Instituto de Higiene e Medicina Tropical. He has an engineer background, but now he works more into information technology systems. And even with him, which is closer to me, when we say scenarios, when we say forecast, we say different things.
Yeah.
And so now talk to a doctor where no scenario exists, no forecasts exist, just a patient's life to save, which is really different.
I must have the thesis in some part, otherwise I can't get it. So send me a mail.
Okay, I will.
I don't know how much useful it is, but she was developing how much beds you need on a hospital, how should locate the service so you can minimize the flows. It was not much optimization in mathematics, it was most like
Conceptual, but you need that.
It was good work.
Because if you're planning a new hospital, this is a new building, not really to replan something, some structure that exists, is to infer for a new thing. You have to know something from how things are done in different places. So you can, in fact, think of them in these settings. People that have been working on this, but they don't publish, are the private hospitals because they are profit-oriented. So they need to know how things work and how you optimize services. They are profit-oriented, but they do that. They don't show how they do it.
Maybe I'm sorry.
Yeah.
You say that you are planning the capacity. In fact, this is extremely related with how the hospital works or how the activities flows inside the hospital. So what you're trying to do is to plan the flows inside the hospital to
come up with the idea of the number of
capacity.
The project, in fact, also have an architectural task, and also have a medical a task, which is responsible of a medical doctor. So there's different skills, and mine is for capacity. But so this will be linked with the architectural structure of the hospital. And that part is civil engineering, and I don't know. But I know that we have to talk, but it's an idea that has not been started yet. So we started talking for this call in December. This is an old dream of this colleague of mine, and he decided to go ahead. So we'll start to think. I don't have really. To the contrary, to the supply chain, which I know the constraints and I know the models, this I don't have an idea how it will work. So this is really pure research. So So that's it. I don't have nothing else to show you. At least it's just an overview of my life, my research life.
Any further question?
I have another question regarding your framework and the job paper.
Yeah.
You say that you spent, I don't remember how many seconds.
2,000 seconds. That case. Yeah.
The simplex model. I know that you are not working with a scheduling problem.
No.
With the scheduling problem, what I found out is that the time discrete models tends to give you a better lower bound, and usually they're more useful if you are going to, I don't know, make some column generation or localization, something like that. However, when you are using pure simplex, the no discrete models, even though they have the worst ones, they seems to be more quickly.
The continuous or the discrete?
The continuous. So in scheduling, especially on parallel machines or single machine, we have this situation. So if you are going to use simplex by its own, it's not very good to use a very elaborated model with time discretization and so on. So my question was regarding this time discrete analysis that you try different models or.
You know, the problem is that when you decide, when you're thinking about scheduling, you're working on a continuous time, in fact, because you have operations that start and end, and they are, you work by the minute. So this is really, or by the hour. So this is really a continuous setting. Here, you're in a different, so here you have a macro perspective. So you're looking into the world on yearly basis. And the idea was to plan, but these are macro plans. So you say you will produce over the next 2 months 1,000 items of this product. So how you plan those 1,000 items, you have to be more specific. In there, you need a more detailed scale, like the continuous one. But in this context, I don't see if it makes sense to have a continuous scale, time scale. So activity will start in, what activity will start in time Sy or Sj or St, I don't know, and will end at St plus something?
Well, no, but in the models, what we do is you can try to model the beginning and the end of the task, or you can say task I is coming first and
Task J.
And you don't care about the specific start times or
ending times.
Or end times. You can get it from the model, but you are modeling just the position or sometimes repairs. But when you go for the discretization, you have bigger models, less bounds, but the capacity of simplex or whatever is going down very quickly.
I know.
Just a curiosity.
You know, have you ever heard of time grids?
Sorry?
Slot time grids?
Yeah, sure. In scheduling we use it as well when you model setup times, and there is a guy from Germany, Evert Meyer, that he do this macro and micro.
You know the Castro works, Pedro Castro works on scheduling?
Yes.
You know
Yes,
Pedro Castro?
Yes.
He's been comparing different ways of defining precedences and the way you model time. Pedro has been working on that with Ignacio Grossman. You know Ignacio Grossman? The chemical engineer. They are really...
No, he has
Yeah.
and there is another trend that I really find very interesting. That is a guy from Brazil, Uchoa, is the name of the guy. And he did something called arc flow, capacitated arc flows.
Mm-hmm.
So they took a network modeling idea, and they discretized also
The time.
And they have amazing models. But again, the linear,
Simplex.
The linear relaxations works amazing well. You get the integer
solution
for small and medium-sized program, then you can.
Yeah, because
you can work with it.
Simplex works best on continuous than on integer. Yeah.
Any other question? No?